Assalamu alaikum. I'm Dr. Shahid Islam. I work at the Queen Elizabeth Hospital in Woolwich in London. Today I'm going to talk about two health topics which are quite widely spread all across the world. My emphasis would be for Bangladesh today. I'm representing Selfless. The first topic of discussion is HIV and AIDS. Before I start my discussion, I would like to emphasize that if any of you are affected by any of the discussion points I talk about and you want further clarifications, I would advise you to seek help from your local health organization or a healthcare professional. If you recognize any of the signs and symptoms that I talk about and you want to talk about it in confidence again, I think it's better to talk to someone early rather than late. The first topic I'm going to talk about is HIV and AIDS. First of all, some epidemiological data about the prevalence and incidence. Across the world, about 40 million people are affected with HIV and AIDS. Every year, about 5 million people get a new diagnosis of AIDS, of which about 3 million people die. So just by those simple statistics, you recognize that this disease can be fatal. In the context of Bangladesh, I've checked some data recently which suggests that about 0.1% of the population is affected by HIV and AIDS, and this is done by UNAIDS, which is an organization that works closely in Bangladesh. The risk groups for HIV and AIDS are people who are involved in sexual work like prostitution, intravenous drug users, and also it's transmitted in homosexual men as well. The transmission is primarily in 75% of people by sexual intercourse. The other 25% can be transmitted by needle sharing in intravenous drug users, as well as perinatally from pregnant mothers to their children. Now I'm going to talk about the clinical features of HIV and AIDS. In the acute phase or in the short term, patients may be asymptomatic. However, within 2 to 6 weeks of what we call in medical terms seroconversion, you will probably see symptoms like fever, arthralgia, myalgia, just feeling tired generally. Associated with that, you may also get constitutional symptoms like night sweats, fever, weight loss, chronic diarrhea, which cannot be explained, many types of fungal or viral infections as well. 30% of the patients develop what we call in medical terms lymphadenopathy, which are glands across your body. Now, what I'm going to talk about next is the diagnosis of HIV. It can be done quite simply by doing a blood test. The modern medical technology allows the antibody to be detected quite early on. The purpose of talking about HIV/AIDS today primarily is to kind of inform you of the potential complications of the disease. It can affect many organ systems in your body. If I start from the top, it can affect your nervous system and it can give you complications like meningoencephalitis. It can also produce infections like toxoplasmosis in the brain. It can also give you signs and symptoms of dementia, which are quite early onset. In the gut or the GI tract, you can get complications like fungal infections called candidiasis. It can affect your eyes and give you viral infections like CMV retinitis. It can also produce different types of tumors such as B-cell lymphoma, non-Hodgkin's lymphoma, as well as Kaposi's sarcoma. In the context of Bangladesh, the most important complication is TB. Almost 30 to 50% of patients with HIV would develop TB at some stage. The management of TB and HIV at the same time becomes very complicated for many reasons because of drug interactions of the two different conditions. It is advised based on modern medical science, that if you've got HIV as well as TB, it's better to treat the TB first for the first few months before you start treatment with HIV. Now, what I want to talk about next is prevention. How can you prevent HIV from occurring? As I mentioned before, there are 2 or 3 main risk categories. First of all, the people involved in sexual work or prostitution. The advice is that you use primary prevention like condoms that will prevent the spread of disease from one person to another. Secondly, to limit the number of clients, or having multiple clients at the same time would prevent the disease. Now, the other risk category is intravenous drug users. So the advice for them is to minimize the amount of needle sharing, because once you share needles which are contaminated, the chances of getting the disease or spreading the disease significantly increases. The third risk category group is patients or pregnant women who are HIV positive, who are at increased risk of transmitting the disease from themselves to their children. And the way to prevent it from passing from them to their children is to either have a C-section. In addition to that, you also are advised to not to breastfeed your baby, rather than that you bottle feed the baby, and to detect the disease early on in your pregnancy so you can have preventative measures and plan your pregnancy accordingly. So that's my discussion on HIV and AIDS. If you recognize any of the signs and symptoms I talked about early, or if you're not sure about anything, my strong advice to you is that you seek help early to prevent any future complications, which could be potentially very difficult to manage, or it could be life-threatening as well. So I'll move on to my next topic, which is hepatitis B. According to recent statistics that I've checked, about 5 to 10% of the population of Bangladesh are affected with hepatitis B. 3 to 5% of pregnant women are affected by hepatitis B, and almost 90% of their babies will be affected by hepatitis B eventually. Now, the clinical features of hepatitis B initially can be quite non-specific, like having fever, arthralgia, myalgia, for instance, as well as having rashes. But more specifically, you can develop things like jaundice and enlargement of the liver called hepatomegaly, or of your spleen called splenomegaly. So this can happen over a period of time. The incubation period for hepatitis B is usually 1 to 6 months. When I say incubation, it means that the virus can sit in your body but without showing any clinical features initially, but it can show the features eventually within 1 to 6 months. The diagnosis is usually by doing a blood test, which checks for the antigen for the hepatitis B virus. 5 to 10% of the people who are affected by hepatitis B eventually become carriers of the disease. And there are implications for that, because some of these people will go on to develop cirrhosis of the liver. Some of them will develop hepatocellular carcinoma, which is a cancer of the liver. These can potentially be life-threatening again. So the advice is again prevention at the primary stages. In particular, I want to talk about those risk groups. So first of all, the people who are involved in sexual work or prostitution. The advice is that you do primary prevention by using condoms and limit the number of clients or sexual partners you have. Secondly, the intravenous drug users, the advice is to stop needle sharing if possible. This is strongly advised because the chances of contamination are very high, and cross-infection is very high if you share needles with each other. Thirdly, pregnant women, again, if the chances of you passing the infection onto the baby is very high. So if it's recognized early, it's best to get the treatment by having passive immunoglobulins or the drugs that are advised by your doctors. So having discussed both of these topics, HIV and AIDS as well as hepatitis B, I think what I'm trying to emphasize here is that these two illnesses or diseases are potentially life-threatening with various complications. They can be associated with many other diseases, fungal and viral, and which can be very dangerous to manage, especially because of the drug interactions. So my advice would be to recognize it early to prevent this from happening in the first place. And if it is diagnosed that one has either HIV and AIDS or hepatitis B, it's better to start the treatment early to prevent any future complications, which includes death. Thank you.